Hello, today we'll talk about abducens nerve, that is the sixth cranial nerve. So let's get started. So I'm making it from the side view. Okay, this is the midbrain, pons, medulla, and here this is superior colliculus level, this is inferior colliculus level, here it's the cerebellum. Okay, and if we'll talk about here, it's the fourth ventricle here at the back. This is the fourth ventricle roof, and here goes the fourth ventricle floor. Okay, where is the abducens nerve nucleus? That is abducens nucleus. It is present at the lower pons level. Sorry for this. At the lower pons level here. Here is the sixth cranial nerve nucleus, abducens nucleus. And if I talk about the seventh cranial nerve nucleus, it is like this. Okay, what happens? Why I'm telling about the seventh cranial nerve? Because the seventh cranial nerve goes behind the sixth cranial nerve nucleus. Okay, and then it goes like this. Okay, so what it does is, in the floor of the fourth ventricle, it forms a depression. Okay, so it moves like this. Sixth cranial nerve will move like this, and seventh will move behind, and then. So if I draw only this ventricle, so it will do like this. This will be like a depression, which is formed by the seventh cranial nerve. Since what is the seventh cranial nerve? It's a facial nerve. So this depression formed is known as facial colliculus. This is the facial colliculus depression formed in the floor of the fourth ventricle by the seventh ventricle, because by the seventh cranial nerve, it emerges from the behind of the sixth cranial nerve nucleus. Okay, so these two nucleus are very in a close proximity to each other. So if something happens to sixth, it's a strong probability that seventh may also get damaged. This sixth cranial nerve, this abducens nerve fibers emerges out, like it goes down and emerges from the pontomedullary junction. This is pons, this is medulla, so it's a pontomedullary junction or inferior pontine sulcus. Okay, this is pontine, so inferior pontine sulcus. As it comes outside, it is in the subarachnoid space. Here there is the subarachnoid space. There are three meninges, pia or pia, then it's arachnoid, then it's dura. So subarachnoid space, and what it is the space between the arachnoid layer and the pia mater layer, that is between the two pia and arachnoid, there is a subarachnoid space, and this space is filled up with CSF, the cerebrospinal fluid. Okay, so it comes out in the CSF, that is subarachnoid space, and that space here, the space, like suppose this is pia, this one is F pia, and then this is arachnoid, so this is subarachnoid space. Okay, obviously it will come out, firstly it will go in this subarachnoid space, and this is known as it is, this nucleus is in pontine region, so this cistern is a CSF filled space, so it is known as cisterna pontis. Okay, cisterna pontis is a CSF filled subarachnoid space in which the sixth cranial nerve emerges out after coming through this pons. Okay, and then after reaching the cisterna pontis, it moves upward along the clivus. What is the clivus? If I talk about, this is a middle cranial, posterior cranial fossa, and this is suppose foramen magnum, and then there is this. Let me show you. You can see here. This is the cranial fossa. Okay, this is anterior, this is middle. This one is middle, and this is the posterior. So in the posterior cranial fossa, you can see this. Here, this is the clivus. Okay, and this is the foramen magnum through which the midbrain and all emerges out. and this is the clivus. From here it will move through the clivus, you can see this line, okay, through this this is a temporal bone petrous part. This part is a petrous part, so it will move like this. Here there will be the cavernous sinus sitting. From here, sixth cranial nerve emerges. Like suppose this is inside, okay, the foramen magnum, and this is the clivus, okay. So this sixth cranial nerve, the sixth cranial nerve from this pontine area, this moves here and then it moves along the clivus, okay. This moves along the clivus, and this, when it is moving through, here was subarachnoid space, that was cisterna pontis, okay, from here. And then after this was suppose this was a pia mater and this is arachnoid. After arachnoid there is a dura mater, and dura mater has two layers. One is the meningeal layer, and one is the periosteal layer, okay. So there is a space between over here with the bone, like this, with the bone which is attached, that is a periosteal layer of dura mater, and here is the meningeal layer of the dura mater, okay. So there is a space between the meningeal layer and this periosteal layer of the dura mater, okay. So through this it is moving, okay, through along the clivus, and this is a type of a canal which is formed, and this canal is known as this dural canal. This is a dural canal, and this dural canal is known as Dorello's canal. This is Dorello's canal, okay, between the meningeal and endosteal layer. You can say anything, endosteal or something. Then from here it enters here. There is a cavernous sinus, okay, cavernous sinus, and this cavernous sinus is also a dural sinus. What do you mean by dural sinus? That it is also made up of this sinus. This space is made up of these two layers, like meningeal and the endosteal layer of dura mater. Through these two, the space which is expanded, this forms a sinus, that is a cavernous sinus over here, okay. This sixth cranial nerve will pass inside the cavity of the cavernous sinus, through the cavity of the cavernous sinus. As we have discussed that third cranial nerve and fourth cranial nerve, fifth ophthalmic division and maxillary division all passes through the lateral wall of the cavernous sinus, but sixth cranial nerve is the only nerve which passes through the cavity of the cavernous sinus, okay. Inside the cavernous sinus there is also internal carotid artery, okay. One more point, like when this nerve, after moving through the clivus, it makes a bend over here like this. To enter the cavernous sinus, it may have to make a bend, like it was moving like this and then it has to make a bend. So whenever there is intracranial pressure, there is high pressure from here or something, then what happens, it's already a weak point, so it, through the pressure, it gets damaged, okay. From the bend, from here, it gets damaged, so it causes sixth nerve palsy. One more point I wanted to tell you, that abducens nerve, this is a purely somatomotor nerve. It's a purely somatomotor nerve, that is, it supplies only that lateral rectus. We have done LR6, so it supplies only lateral rectus of the eye, that is the extraocular muscle. So there is sixth nerve palsy. Like lateral rectus is, if it is not working, okay, if lateral rectus is not working, then we might think that there is a problem in the pons related to the sixth cranial nerve nucleus. First our attention goes towards here, that if the lateral rectus is not working, then it might be the problem in the pons nucleus, that is abducens nucleus. But this is, if the damage is over here, this bend through the intracranial pressure, then that is a false sign, okay. Like the problem is over here, but we are thinking to be here. So this is a false localizing sign. What it is known as? False localizing sign. Like if the lateral rectus is not working, we think sixth nerve nucleus damage at pons, but more often we are false, we are wrong, because damage is at the bend. Okay, so this is this is known as false localizing signs, that we are localizing at different point. So this is false localizing sign. So as we discussed, sixth cranial nerve passes through dura mater from here and then inside the cavity. This is also a dural sinus. So sixth cranial nerve has the longest intradural course. What is abducens nerve? It has longest intradural course, moving from here and then into the cavernous sinus. So this is a superior orbital fissure. Ahead of it is the orbit. Okay, so and this is that tendinous ring. Okay, we discussed in last videos also. The hair outside this tendinous ring goes the lacrimal of ophthalmic artery. Ophthalmic nerve. Then it goes the frontal nerve of the ophthalmic nerve. Then the trochlear nerve, that is LFT, liver function test. You can, and then here. Then there are fourth cranial nerve goes like third cranial nerve upper division, like oculomotor upper division, then nasociliary, then lower division. Okay, fourth goes here, and then this is sixth. So sixth cranial nerve enters the common tendinous ring. Through common tendinous ring, superior orbital fissure, it enters. Sixth is also here. Okay, so it enters and then supplies the lateral rectus of the eye. As the name suggests, lateral rectus. This lateral rectus is at the lateral side of the eye, and what it does, it from the lateral side it pulls, that is abduction. So it does the abduction of the eye. So this was about sixth cranial nerve. Thank you.